My name is Dr. Arnice Jackson, and I am a family nurse practitioner. I am also the CEO and director of a nonprofit called The Color of Health. And at The Color of Health, we focus on providing health education to not only communities of color, but to also healthcare providers, so that way people are getting unique and tailored healthcare. Working as a practicing clinician, I just saw so many health inequities, especially for Black women, and it just kind of really felt like a calling for me. Even the term health disparities, it's a polite way of saying, racism in healthcare. My area of expertise, my area of passion is women's health. And gynecology in America has been built off of the backs of Black women's pain, under this inherent belief that we are not even human enough to feel pain. There's the struggle of where do we begin? We have healthcare providers who have these innate beliefs that they don't even know where they came from because they're so ingrained in our healthcare system. And we're trying to change minds. We're trying to, we're working with policies. We're trying to change laws. A lot of the challenges really do center on the fact that we're up against this belief. It's ugly. It's dirty. It's really sewn into our society's fabric that, non-whites are not as intrinsically entitled to healthcare. And that's hard. That is not something you're able to do in one nonprofit meeting or at one community service event. It takes a lot of patience and dedication. When I hear delayed freedom, what I hear is my rights, my entitlement as just a human being, on this earth is something that I have to work for. I hear that my happiness, my pursuit of liberty and all those things are not given to me, that it's something that I have to wait for. So as a practicing provider, as a clinician, I don't feel free because I'm so aware of the systems that I'm working in and the guidelines that I have to follow, knowing that it's not that way for everyone, right? It doesn't work that way for all patients. Patients don't match a textbook. We are complex and layered, and we have our own experiences and circumstances and cultures that dictate our health. So in some ways I feel so bound because the way that I've been taught to practice kind of goes against what I know intuitively. And I think that is frustrating. It's frustrating, and I have to find ways to still show up as my full self, to still show up as a Black woman in the way that I practice, working within a system that was not designed for my own community or for others. Spiritually, I feel free because it is an honor to be aware of these things. I know that these systems are created and I get to show up every day and make a difference. I feel free in the way that I can think about these things and tailor my practice or my approach. I'm free to navigate this space and figure it out and challenge it and try to change, the status quo. I feel free to access knowledge. You can put restrictions on a lot of things, but you can't restrict my mind. We need better laws. We need laws that specifically call out unconscious biases or, obvious racism in healthcare. We need accountability. That's one level, right? We need better policy. But then also we have to change these inherent beliefs that we're not human, that we don't feel pain. We have to change these beliefs. We all need to do the work and figure out what our unconscious beliefs are. If we really truly want to get rid of institutionalized racism in healthcare, we got to change the laws. We got to keep fighting. We got to keep protesting. And I'm a firm believer that everybody has their niche. Everybody has to serve a purpose, right? Not everybody can be out protesting. Not everybody can be out in the clinics doing the work to physically take care of our people. Not everybody's going to be in the library. We each need to figure out what it is that we need to work on, what we need to learn, what we need to unlearn. It's going to take a lot of mindset, beliefs, and changes on all sides. It's going to take a lot, but I know that we can do it. I firmly believe that it can be done.